Hi everyone, welcome to my channel. Today we'll be talking about nitrogen narcosis. So nitrogen narcosis is basically a phenomena when divers they go deep around the sea. So basically at surface the pressure is 1 atmospheric pressure, right? So every 10-meter descent is going down, okay? So every 10-meter descent there is addition of 1 atmospheric pressure. So it keeps on increasing as we move 10-meter down. So further 10-meter down it is going to be 1 meter further addition, that means 3 atmospheric pressure. So when divers they go deep down, what happens basically, there is increase in pressure, right? So whenever there is increase in pressure, we know that there is increase in solubility of gas, right? So whenever pressure increases, the volume reduces as per Boyle's law. Fine. So volume is reduced, that means volume basically there is increase in solubility of that gas. So volume reduces. So how volume reduces? It dissolves into fats. So this phenomena leads to euphoria condition. That means people, divers, they will feel happy first of all. Well-being feel they will feel. And then the gas dissolve in myelin fibers of nerve fibers, which leads to there is decrease in decision making, decrease in cognition, decrease in motor planning. This is called diver's palsy because motor movements are disturbed because of affected myelination, right? So overall there is decrease in performance, right? So this is called nitrogen narcosis. Mind it, decompression sickness, this is not decompression sickness. So whenever nitrogen narcosis comes, you have to perform this thing. Whenever decompression comes, you have to perform the other thing which we are going to explain just in few seconds. So ultimately how you can get caution of nitrogen narcosis, then you can either get caissons disease, diver's palsy, decompression sickness. Fine. So caissons disease is nothing but the same phenomena where basically when construction workers they go into dig and into canal they will work, that is called caisson. So the same phenomena occur with them also underwater work areas, okay? So narcosis is nothing but drowsiness and because of nitrogen. So ultimately this phenomena occurs because of when nitrogen dissolves. Because if we talk about air mixture, the most important part is nitrogen only. Oxygen can be used and CO2 can be released. So nitrogen is the main which is causing this thing. So this is called nitrogen narcosis. Along with there can be some toxicity of oxygen as well. So whenever more oxygen is available, there is inhibition of respiratory centers. We know that we need CO2 level to basically stimulate the respiratory centers. So whenever oxygen is more, there is inhibition of those respiratory centers. Okay, and obviously whenever oxygen is more, there is increase in free radicals, so which can cause tissue damage. So that is called oxygen toxicity. Now we'll be talking about what is decompression sickness. Let's see what is decompression sickness now. So we were talking about descent till now, okay? Now what if divers come up upward, right? So during ascent, that is called ascent. Fine. Now the dissolved gas, because of the sudden ascent, the dissolved gas are released because of decrease in pressure now, and they are released as bubbles. So whenever the bubbles are released, what can happen? So in muscles, there can be severe pain whenever the bubbles are released. And from joints it is released, it's called bands. Joint pain, there is severe joint pain. So that is called bands. So in exam, you can get bands, okay? So in lungs, it can get the blockage of the arteries. So chokes, it can get. And in heart, because of vascular damage, it can there can be ischemia, so myocardial infarction it can occur. In brain, CVA can occur, cerebral ischemia can occur, and diver's palsy we have already discussed. So embolus can basically block any vessel and cause death. So that's all about the consequences of decompression sickness. So what can help? What we can do to prevent this? So first of all, the first thing which can prevent it is slow descent. Slow ascent, sorry. So they should come slowly, okay? So that can help, first thing. Second thing is, second prevention is instead of nitrogen, we can use helium. So helium is not going to mix so well, so that's why this is inert gas. So that's why solubility will be less as compared to nitrogen. But ultimately at higher pressure, it can also lead to symptoms. Fine. So what can be done if the symptoms has already occurred? Fine. So what we can do is, if the subject has already came on surface, So what we can do is we can put them into recompression chambers. Okay, recompression chamber. So again we have to increase the atmospheric pressure gases so that it can again dissolve, so the nitrogen can again dissolve into fats. Okay, so recompression is done first, and then slow decompression in the same chamber. So slowly we have to reduce the pressure, and that is causing decompression. So this is the way that we can prevent those symptoms, and they will get time to actually release in minute quantities, which is not leading to so much symptoms. So that's all about nitrogen narcosis, caissons disease, decompression sickness. I hope it's clear to you. If you have any query, you can comment below. Thank you so much, and please subscribe if you like my video. Thank you. Bye bye.